a few questions already in the chat, and I would suggest that people send their questions via text by the chat. So there are a few questions there already.
Okay, I'm checking. Monitoring now. The question we have here is there was a question before. How much was it? Where's there is one. Yeah, that's what was the minimum number of samples to validate the kits? Dr. Lee, will you come here to answer?
We use about 40 to 50 positive samples and about the same number of negative samples. These samples were COVID-19 patients who were diagnosed in Korea from 20 January to 27 January, and all samples was diluted to make the various level of viral load, and this whole sample was tested by the four medical centers, including Korean CDC and 3 private hospitals. And the only test kit who showed the same result between the multi-center evaluation was approved to use in Korea.
The samples should be transported in a refrigerated state within 72 hours. If you need a longer period, it should be frozen.
And Korea also has the logistic system for the infectious material to transport to the remote clinical laboratory. Rapid test is not adequate because the rapid test is not completely evaluated in current situations, and also the antibody test can detect the patient after the 7 or 14 days after onset of symptoms. The antibody test, the rapid test including antibody test, is not appropriate to detect the patient in early stage.
글로벌 지금 코스트 코스트 테스트
the testing cost is in Korea is about $60, but in public purpose, the test cost is free for everyone. The purpose of the daily surveillance survey is to find the epidemiology of COVID-19 in various regions in Korea, and also we pursued the positive rate to kiss accuracy.
How much is the cost of each?
Yeah, well, it depends on the test volume that you are dealing with. For the extractions, I think it costs about 40 million Korean won. It's about 40,000 US dollars. And for the analyzer, it costs about 30 million Korean won. It's about $30,000 US.
The prevalence of asymptomatic patient is very different according to the papers reported in some journals. About 20, currently, about 20 or 50% of patients can be detected in asymptomatic stage, and according to Korean data, the 33% of patients was asymptomatic patient at the time of detection. To answer that question, we should get the serological data to determine the standard populations, but we don't have any serologic data, so we can answer only the limited. We can answer the only limitedly, and about in our idea, the percentage of false negative may be very small because we should do the test repeatedly in suspected case.
Let's see.
John, this is Roberto. I have some questions in Spanish. If you agree, I'll read them to you. I'll translate and read them to you from those in the Spanish transmission.
Yes. Okay. So Luis will translate to English, right?
I will. I have them.
Okay. Very good.
Okay. So the first question is, what is the specificity of the test?
Exactly.
In our data, the specificity is more than 95%.
Okay. And then the second question is, how does the delay in publishing the tests, how much does it affect the decision making in public health?
In Korea, every test can be reported in about 24 hours when you using the clinical commercial laboratory, and in healthcare and also in hospital, the result for COVID-19 is maybe reported in about 3 to 12 hours, within 3 to 12 hours in each hospital.
Thank you. Another question, is there any particular kit that you would recommend?
But in Korea, 2 test kits is most widely used among 5 test kits. The first one is Cogen and second one is Seagen.
And have you been able to detect the virus in asymptomatic persons?
In Korean data, 30% of patients can be detected in asymptomatic stage, and some of them can keep the asymptomatic status going, and another patient can develop the symptom after detection. And according to the some journal, about 20 to 50% of a patient can be asymptomatic at the time of detection.
I guess there is another question. This is, I'll try to read it. I'm not a biochemist by any stretch of imagination, but if all these tests are of PCR-RT, or what are the tests that you have that are, which ones are faster? I guess this is the question. I don't know if I... Faster, yeah, quicker.
When you compare the time to report the result between the conventional PCR and RT-PCR is more superior than conventional PCR and is more reliable and more convenient.
Thank you. I think those are the questions that I had. Oh, there is a final question. Do you recommend antibody tests?
No, I cannot recommend antibody testing in current situations in Korea because the antibody test can detect the patient about at the early stage. Antibody tests cannot detect the patient at early stage, and at that time, the sensitivity of antibody testing is maybe lower than 50%. And after 14 days after symptom onset, at that time, antibody test can detect the patient with a sufficient sensitivity. But at that time, most of the patients cannot shed the virus. So, and most of the patients may be getting well at that stage. So, at that time, the testing for COVID-19 is not required. So, antibody test is not recommended in Korea.
What kind of?
We use 4 kinds of PPE in Korea. The first one is mask, second one is goggle, and the third one is gown to cover the entire body, and the fourth one is glove. I don't know the current situations of laboratory in Latin America, but the most important one is the getting the test machine and buy the test kits, and also grow up the specialized person who work for molecular assay. But all of these kind of actions should require times. So if you need the maximum capacity of testing, and then you should 검사를 의뢰해야 된다고 얘기를 해야 될 것 같은데. Refer the test kit another countries or another laboratories.
Is that